This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
Our medical minute today is going to be just on some pearls relevant to the QT interval with EKGs. We got a cool EKG here that you guys can take a look at for a patient that had an overdose. Looking at it, you can see some things that are relevant. So regarding an EKG and them having a prolonged QT interval, do you know, is it more concerning if they're tachycardic or bradycardic? Bradycardic, for sure. And they're more likely to have R-on-T phenomena. So the whole concern with having a prolonged QT interval is it makes it more likely for you to have a premature beat that hits on the T wave, and then you can go into this micro reentrant circuit and go into VTAC or ultimately VFib. And so you would go into Torsades first, which is really just polymorphic VTAC, and it's polymorphic VTAC with a prolonged QT, and that is Torsades. So you can have polymorphic VTAC and not be in Torsades, which is when you don't have a prolonged QT interval. If you have a prolonged QT and it's polymorphic VTAC, we call that Torsades. What is the treatment for it? It's MAG, right? Just 2 grams of MAG, super easy, super safe. If the patient did go into VTAC and we had to give an antiarrhythmic, which one would you use? So we had 2 options. Like if you have our ACLS meds, right? What are our 2 antiarrhythmics in ACLS? So we have amiodarone and lidocaine. Which one of those prolongs the QT? Amiodarone prolongs the QT, so that's when I'd probably make the audible move to using lidocaine. So that's just a quick, it's 100 milligrams, just one little move to make when you're dealing with the patient who has that. One other pearl about this that I think is really useful is that when you have a heart rate that's under 80, you don't do a QT corrected. You just measure it. The whole point of a corrected QT interval is for when they're tachycardic. And when they're tachycardic, because then the T wave has to kind of shrink down a little bit and in order to fit in between the beats. And so then you have to do this formula to correct for it to see like, oh, this is what it would be if they weren't tachycardic. So if they're not tachycardic, you don't need to do a corrected. You just measure it. So just keep that in mind. So it depends on if you're a male or a female. I don't want to misspeak, but I think it's 460 for a male and 480 for a female. But go back and just check that real quick. But I think that's what it is, 460 and 480. And if you're just doing the eyeball test, is your T wave basically going more than halfway between your beats? If you just had to like get it and see. But yeah, on this one, it's just definitely abnormal. You can see it's super long. Yeah, that's 590. And so there's lots of meds we have to be super careful of giving them. And this is a person that needs magnesium like right away.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.